It's been said that having anxiety is a lot like the activity of being in a rocking chair. We oftentimes go back and forth, preoccupied with worry, and yet, after our best efforts at controlling the future, we realize my worry really hasn't gotten me anywhere. In today's video, we're going to be talking about what is actually anxiety, what are the several different types of anxiety, and what types of things can happen in therapy in order to cope with or to try and manage anxiety. Anxiety is the experience of, get this, the fear-filled anticipation of a threat that's either immediate or in the future. This fear can be so intense that it can actually lead to uncomfortable symptoms that manifest themselves within our bodies. Some of these uncomfortable symptoms might be sweating, tight chest, gastrointestinal discomfort, possibly even thinking that you're having a heart attack, or numbness or tingling in the hands. In addition to that, as we kind of rock back and forth with our thought life, these threats can either be substantial and real and credible, like a weather crisis or something to that effect. But at the same time, sometimes our anxiety can actually manifest as a result of intensified imagination. So things like considering the worst case scenario of what happens if I don't get into college, or what happens if I totally flake out on that big presentation at work. It's going to be doom and gloom. Again, the anticipation of these future events can lead to such debilitating symptoms that they can actually spill over into our quality of life, hurting us and hindering us our ability to be able to perform, which might lead to behaviors such as staying indoors because we don't want to go out in public for fear that we might have a panic attack and that there's no escape. We might avoid social situations or public speaking because we're afraid that we might die if we can't effectively cope with some of those future events. So because of this debilitating nature of anxiety, it can lead to analysis paralysis, and these symptoms can actually show up for the majority of days in a 6-month period, thereby hindering our quality of life. So this leads us to what are the different types of anxiety-based issues that could show up in your life or in counseling. For the sake of this video, I'll just touch on 3 very brief. The first one would be generalized anxiety disorder. Now, generalized anxiety disorder is anxiety that is essentially pervasive in multiple avenues of a person's life. It could be their relationships, their health, their job performance. They're just afraid of essentially a lot of things. Now, in contrast to that, we might have a phobia, whereby the individual is experiencing anxiety-related symptoms, not about everything, but maybe specific things like certain types of snakes, or the fear of flying, or the fear of being in closed-off, close, tight-knit quarters. A third type of anxiety-based issue might be the issue of OCD. So OCD simply stands for obsessive compulsive disorder, which essentially means that the person will experience emotional distress, and the only way to deal with that emotional stress is by participating or rehearsing a specific ritual. So it would be like an individual who's afraid to leave their house for fear that it's going to catch on fire, so they have to check all of the stove knobs 13 times each. And because of that, those rituals might make the person habitually late, so it impairs their quality of life. So those are just a couple of examples of anxiety-based issues that could show up in counseling. So when it comes to coping with anxiety, most therapists will probably start off with trying to foster resiliency within your life for the purposes of trying to cope with those physical symptoms. That's again the rapid breathing, that's the sweating, that's the mental preoccupation. Sometimes those symptoms may be so debilitating that a therapist may actually make a referral to a medication provider, a PCP, nurse practitioner, a psychiatrist, and the psychiatrist might put you on a small regimen of medications for the purposes of aiding in quieting down some of those physical symptoms. Now, assuming we've got those symptoms somewhat managed, we can now begin the process of identifying the origins of the anxiety. So, through talk therapy, we may explore your life in order to find at what point throughout your life was the onset of those symptoms happening. Now, in some cases, we can identify a hypothetical origin. In some cases, we can't recall. But what we can do, whether or not we do find them or don't find them, we can try to isolate, well, what are some of the core beliefs that maybe I tell myself in my head about doing that presentation, or about going out on a date, or about getting on the elevator? Generally speaking, there are negative core beliefs that we rehearse in our mind. Maybe it's through a powerful statement, maybe it's through imagining worst case scenario. And throughout the time of therapy, what we do is we will begin the process of trying to work with you to challenge those thoughts and to progressively expose to new ideas and new adaptive core beliefs. So that in a nutshell is kind of like a quick 1,000-foot view of what it could look like in therapy to cope with anxiety. So that's a quick overview of some of today's kind of topics. The issue of what is anxiety, what are some of the different types of anxiety issues that can show up, and what types of things are done in order to cope with anxiety. Now, working with a mental health counselor can oftentimes bring to the table professional support, professional direction, and professional accountability with managing any mental health issue. It's for that reason, be sure to schedule with us if you're interested in scheduling either a brief consultation or an intake appointment. If you like the content that you've seen today, be sure to either check out some of our other videos on various mental health topics, or you can follow us on social media platforms. Finally, from us to you here at Good News Counseling, thanks so much for coming by today and checking out the video. We hope to hear from you soon. Until next time, thanks and God bless.